Kia ora, ko John Parsons toka ingoa, Associate Dean Postgraduate Research at Mātauranga Hauora, the Faculty of Medical and Health Sciences. If you're wanting to advance in your profession, lead research that improves people's lives and health outcomes, or become an advocate for change in your field of expertise, doctoral study offers that opportunity. As a world-leading health and medical sciences faculty, our global ranking amongst the top 100 universities is evidence of our commitment to academic and research excellence. As a doctoral candidate, you'll have the opportunity to learn in a research-rich environment, collaborate with world-class researchers, and build the skills you need for a successful future in academia, industry, and beyond. We have a proud history of attracting and growing preeminent researchers and talented students. We host numerous research centres who are leading groundbreaking research. Our research teams in these areas provide nurturing and highly supportive doctoral supervision in an innovative learning environment. Doctoral studies represent the highest level of academic success at the university and are respected worldwide. At the Faculty of Medical and Health Sciences, you can choose from 12 different areas of PhD study, ranging from broad topics including health sciences or biomedical science, to more focused areas such as a PhD in ophthalmology, optometry, or health psychology. We also have two named doctorates, the Doctor of Health Sciences and the Doctor of Medical Sciences. Doctorate is an umbrella term that encompasses a range of degrees in the Faculty of Medical and Health Sciences, Doctor of Philosophy, Doctor of Medical Sciences, and the Doctor of Health Sciences. All of these doctorates represent the pinnacle of academic excellence. Both the Doctor of Philosophy and the Doctor of Medical Sciences have a strong research focus in a particular subject, whereas the Doctor of Health Science is focused on the application of theory, advancing research and leadership in a professional setting. For senior medical professionals, our Doctor of Medical Sciences offers an ideal platform to lead and pioneer within your field, pushing the boundaries of knowledge and medical science. For senior health professionals, the Doctor of Health Sciences is crafted to propel you into leadership roles with advanced academic and professional preparation for service and leadership positions. Embarking on a doctoral degree typically requires 3 to 4 years of full-time dedication to research, culminating in a thesis that advances evidence at a national and international level. You can also choose to study part-time, which provides the flexibility to continue with your workplace commitments alongside your study. Our university offers expert guidance for your doctoral studies, pairing you with supervisors who are internationally recognised specialists in their field. We ensure an enriching doctoral journey with trained supervisors and support mechanisms including peer meetings, online writing groups, and a wide choice of skill-enhancing workshops. Our pastoral care team will make sure you're well looked after and have a great experience with us. There are a number of scholarship opportunities for health professionals considering a doctoral degree, which we can help you identify. From improving health outcomes, leading innovation in healthcare practices, to advancing medical knowledge, doctoral studies allow you to initiate and advance research in an area you're passionate about. Doctoral study places you at the pinnacle of your profession, unlocking a range of career avenues. A doctoral degree is a testament to your capacity for high-level thinking and integration, providing a competitive advantage in all your future endeavours as a subject matter expert in your field. As a doctoral candidate, you'll become part of a high-calibre research community rich with experience, encompassing individuals who are health professionals and scientists at the forefront of leading change in the health sector. Some of you, inspired by your own mentors, may seek an academic career to mentor the next generation. A doctorate is essential to supervise PhD or doctoral students, enabling you to give back and mentor students at a higher level. Many of our graduates are highly sought after, taking on diverse and influential roles within the health workforce. Some secure senior positions in hospitals and healthcare centres, while others excel in the pharmaceutical industry and health promotion, or lead international research teams in biomedical science. Now is a great time to advance your education and lead research in health that can make a positive impact on society. With the Doctor of Medical Sciences, you could be leading medical innovation that significantly impacts people's lives. The Doctor of Medical Sciences is a research doctorate tailored for experienced medical clinicians who want to pursue advanced study and research without pausing their practice. You might be a generalist, a hospital-based practitioner, or a specialist such as an ophthalmologist. With insights shaped by your clinical experience, you have identified unmet needs in health, knowledge and services. You are looking for new ways and solutions to tackle these deficiencies head-on, to dive into uncharted territories, bridge knowledge gaps and elevate your field. This doctorate could be the change you are looking for. The Doctor of Medical Sciences is available for both full-time and part-time study. Candidates usually undertake research for 3 to 4 years full-time, and part-time students would be expected to complete their doctorate within 8 years. To be eligible, you must already hold a medical qualification and some research experience. The great thing about this doctorate is that you can incorporate years of retrospective research from your own clinical experience into a quality thesis, advancing your expertise while maintaining your clinical commitments. And if your study does include retrospective research, the enrolment period required to complete your thesis can be reduced to 12 months full-time or 24 months part-time. Any research undertaken during your doctorate can also be directly applied towards clinical and practice issues. Upon completion, you will become a leader in your profession through the advancement and dissemination of knowledge. Here at the Faculty of Medical and Health Sciences, we are renowned for cutting-edge research in specialist areas including cancer, neurological and cardiac studies. Each department within our faculty contributes profoundly to the healthcare landscape. Your doctorate thesis could cover a spectrum of projects, from unravelling genetic mysteries to assessing public health trends like heart disease prevalence. You may even spearhead a national clinical trial testing new therapeutic possibilities within your thesis. If you share an aspiration to revolutionise healthcare, extending beyond patient care to engage in groundbreaking projects and research, and be at the forefront of addressing clinical and medical challenges, this could be the programme for you. Your contributions, often recognised within a few years, could leave a lasting impact.
Kia ora koutou, ko Rachel Park tōku ingoa. I'm the Associate Head Postgraduate Research, Te Kuranehi, Faculty of Medical and Health Sciences, Waipapa Taumata Row. Today I'm going to talk to you about our Doctor of Health Sciences course and the pathways that this will open for you. If you're passionate about the future of healthcare in New Zealand and making a difference in the field, then this is the program for you. We know that studying and working can be a lot of work, and so this course has been designed to offer flexibility for you. You can still do your job and study with both full-time and part-time options available. Firstly, congratulations on considering a doctoral degree. It's a really big decision for you, your whānau and your career, and finding a program that works for you and your situation is really important. Remember, it's normal to feel nervous about taking this step, but seeking information is always the beginning. The Doctor of Health Science, or DHSC program, is a really exciting opportunity for health professionals and senior leaders within healthcare in Aotearoa, New Zealand. The program is both research-based and professionally focused. The DHSC program is characterised by the development of new ideas or practices that will provide leadership within healthcare, both nationally and internationally. The program provides a combination of taught courses and a thesis, which will develop candidates' professional understanding and expertise in leadership, research, implementation, evaluation, and professional practice. Students will address contemporary issues that challenge the healthcare sector and will influence local, national, and international health policy and practice. It's an opportunity to shape Aotearoa's future health in an area that you are passionate about. This program is going to attract applicants who are senior, experienced health professionals, leaders, and academics from throughout the healthcare sector. So this might include nurses and allied health staff, such as physiotherapists, speech-language therapists, optometrists, pharmacists, anyone within a healthcare setting. The DHSC is a taught or professional doctorate, and it is anticipated that students will enrol part-time. Now this is good because it means that you can still carry on in your workplace alongside your study. This is an ideal option for many who either do not want to or cannot easily step away from their clinical commitments. The DHSC has a strong focus on health and wellbeing in Aotearoa, New Zealand, and on enabling graduates to improve the health and wellbeing of our communities. Content within the taught component of the course focuses on the social, economic, and environmental influences on Māori health and wellbeing, and the contribution of whānau, hapu, and iwi health and wellbeing. A number of students will focus on topics which directly contribute to Māori health development, and in preparation for their thesis research will focus on key issues in Māori health development, critically analysing a health issue and framing research in professional contexts. The course is delivered through a mixture of lectures, seminars and workshops, delivered through both blended face-to-face block courses and also some online delivery to make it easy for you. The great thing is you do this with like-minded colleagues as part of a cohort, so there's lots of support. Now, how will this help you shape the future? The Doctor of Health Science will equip senior health professionals and leaders who are passionate about shaping the future of health in Aotearoa with advanced academic preparation for service, leadership, or academic roles. And it provides a really dynamic learning experience in an environment of scholarship and research, and develop healthcare leaders with the knowledge, skills, and evidence in clinical reasoning, judgment, and decision making that will inform health service delivery and practice and improve outcomes for patients. You will learn skills to lead health service delivery to meet the diverse health needs of the population, prioritising Māori and Pacific within an interdisciplinary context across acute, primary or community care settings. And you will demonstrate an advanced, flexible and analytical approach to generate, critique and use knowledge while contributing to the evidence base of healthcare practice and delivery through your world-leading and innovative research. Doctoral study can help broaden your career opportunities or ensure career advancement and help you thrive in our ever-changing world. It will help you develop your confidence and ability to advocate for change in your clinical environment. You will learn new skills, knowledge, problem solving and stamina to pursue your aspirations and foster collaborations and networking within your discipline. Finally, if you are someone who aspires to achieve academic excellence and lead the development of knowledge within your profession, then this is definitely the program for you.
Kia ora, Sam and Komal. Can you please tell us briefly about your background and what you're studying?
Kia ora. So my journey to getting to my thesis research is varied and interesting. I'm looking at the quality of online videos in health professional education. And so if I go back quite a few decades, I was born in Fiji and then I moved to Wellington as a child. I was fortunate enough to get accepted into Otago Medical School. And then I moved up to Auckland for my junior doctor training years and have subsequently specialized to become a pathologist. And then that moved on to a PhD later on.
Thank you.
Kia ora, Andrew. The journey to becoming a PhD student has been an interesting one. I'm new to health, but currently a PhD student in the Faculty of Medical and Health Sciences, situated in the School of Population Health. I have studied non-health programs before, social sciences and then educational leadership, primarily because I've worked in community or student-facing roles, which I have thoroughly enjoyed. And amongst that time, I've always been interested in, I guess, Pacific lived experiences here in New Zealand. Some of the things that we do really well as a community, but also some of our challenges, which has then perhaps catapulted me into a PhD journey.
What's been the most rewarding part of your journey so far?
It's all the people that I've met and the communities that I'm able to access through the University of Auckland. So I'll explain the people. My supervision team is made up of a great group, and two of them, when I first started, were females with children. And so that's a category I fit into. And I see a lot of mentorship from them and get a lot of guidance from them as well. And the communities, well, I've been able to apply to different scholarships and communities to be part of that and learn from that.
And how about you, Sam?
Probably for me, two main things stand out. I know parts of research is discovering new knowledge. My pursuit currently is not necessarily finding new knowledge, but collecting stories from our communities and via the PhD amplifying that, putting a spotlight on our lived experiences. I find that a privilege, and I've thoroughly enjoyed being able to collect stories and do my part to tell the world about Pacific people living here in New Zealand. The second part is I come from a qualitative background. It's easy to chat and talk and connect with people. Numbers have escaped me for a very long time, but I was thoroughly encouraged / voluntold by my supervisors to do a mixed method study, which has involved some quantitative methods. The statistical analysis has been probably a nightmare for me, but I have survived and I've learned some new things, and it's really reminded me that you can stretch and you can grow and you can revisit things that perhaps you thought maybe you would never learn. And so I wouldn't call myself a mathematician right now, but I think I've been very lucky to have relearned and engaged with maths at a much older age these days.
I'm interested to know how you balance your research and your studies with your other life responsibilities and commitments.
I'm not sure I do very well, actually, and at times better than other times. But one of the things my supervisor said to me is, imagine life as a whole lot of glass balls that you're juggling. Or I imagine them as glass and plastic ones. So the plastic ones I can drop and they'll bounce back. But the glass ones are really core values, like my family or my health, that I don't want to compromise on. And at times you sort of juggle them in different ways to sort of fit it all in, because there are only so many hours in a day. And I sort of look at if you look at my calendar, it's stressful. So I'm trying to juggle young children, a medical career, a husband who's busy, but that's not different to other people, actually. Lots of people do it. But I think we were talking before we started this interview, Sam, there was a lot of time I was wasting doing random stuff on social media, say, and it's just taking away those things, because for now my priority is getting through my thesis research. So I see it as adding value, not just to my career, but as an important source of information to the world. And just managing that, yeah.
Okay, thank you.
I'm going to steal Kamal's analogy given by his supervisors.
Yeah.
I definitely resonate with the juggling, but perhaps never considered that there were glass balls and plastic balls, of which there are some things that you can drop and they will bounce back, and there are some things that you drop and they're shattering. And so I can definitely resonate with that. You become pragmatic, you learn to be efficient, and you have to consider what's important to you and our family. Exercise, rest, all of those things are really important, but it's a constant juggling act, and there'll be times where it's, I don't know, there is organized chaos in terms of your juggling, and there are other times where you are frantically juggling, but you do your best. And I think, I think I've just learned to juggle well, tend to the things that you do that's important to you, and stay on top of things. It's an ongoing juggling act, but find time to step away from the PhD.
Yeah, that's
important.
right.
Okay,
I've asked for help many times,
Right.
which is helpful. You know, like with the stats, I was doing a lot of statistical analysis and I just could not progress. And my supervisors are really responsive. So it actually made the progress faster. Whereas the old me 5 years ago would be like, oh no, but they're going to think I'm so dumb and this and that. And all this narrative happens in your head. And no one thinks like that.
No.
They just want you to progress and be happy.
Yeah. I really naturally segued into my final question. So apart from asking for help, what advice would you give somebody considering doctoral study in medical and health sciences?
I made an active choice to come to the University of Auckland, and I spoke with my colleagues and they spoke very highly of the degrees that we had at the university. It's world renowned, but sort of to investigate what area you're interested in and maybe look at, there are either scholarships or PhDs that are advertised because someone else has the research idea, or if you have one in particular, you might need to find the right team for yourself. And so I found I work with a team of people that have children and perhaps older, so they understand my needs at the time. Sure. So that's been very helpful. But to sort of spend some time thinking about where you would like to go, I find that this is an amazing university to be part of. It's just to make sure you find the right people to connect with. There's a lot of mentorship out there and a lot of opportunities if you just find the right ones.
I think I'm going to dovetail off what Kamal said. Surround yourself with amazing people. Contrary to perhaps an undergrad degree or a master's program, which often there are prescribed requirements, a doctoral program often is a huge amount of options on how you might want to weave various things together, which is exciting. I get in part it can be daunting because you want some guidance on, do I have to do it like this or do I do it like that? How long does it take? And pretty much everything's on the table of it depends. What's important to you? You might be passionate about a few things, either in your working profession, in your community life, in your family experiences. The PhD is an awesome opportunity to bring that to life via a big project. And coming back to the juggling, it's a big project management exercise of juggling things. But I think you learn a lot about yourself, you learn about knowledge, you learn about the world of academia, science and so forth. And so having a team that can back you up and guide you and support you and push you and maybe tell you to harden up, you'll be all right. And I think not to perhaps minimize the challenges at play, but I think I want to fully emphasize that I consider myself an accidental academic. I never would have thought I would have done a PhD. So I guess my encouragement though is that if you can juggle, if you're prepared to sacrifice some things for whatever cause and bigger purpose or outcomes, and put a bit of work at that and just get through, I think a PhD is definitely feasible because to date I'm still alive, and I just think you don't need to be smart, but you be prepared to work hard and get through to the end.
You're not just alive, you're thriving.
Thank you.
So thank you very much, Sam and Kamal. It was really lovely to meet you both and hear about your experiences studying a PhD at the University of Auckland.
Thank you, Andrew.
Thank you.